Good afternoon, and thank you for joining us for our daily briefing in the fight against COVID-19. I'm joined today by Dr. Jenny Harris, the Deputy Chief Medical Officer, and Professor Stephen Powis, the Medical Director of NHS England. I'd like first to update you all on the facts about the spread of COVID-19 and the steps that we are then taking in the battle against this virus. 143,186 people have now been tested for the virus. Of those, 25,150 have tested positive. And sadly, yesterday we recorded the highest single increase in the number of deaths as a result of COVID-19. 381 people died, meaning that of those hospitalised in the UK, the number who have passed away now totals 1,789. Every death is the loss of a loved one, and our thoughts and prayers are with those who are grieving. Overall, 10,767 people in England have been admitted to hospital with COVID-19 symptoms. The largest number of those is in London, with 3,915 people in hospital care, while in the Midlands, the number of those hospitalised is now 1,918 and accelerating upwards. These numbers reinforce the vital importance of following the government's social distancing guidelines. The more we restrict contact, the more we slow the spread of the infection, the more that we can help the NHS build the capacity needed to care for those most in need. And that capacity is increasing. More NHS staff are returning to the front line, and more testing is taking place to help those self-isolating come back and to protect those working so hard in our hospitals and in social care. But while the rate of testing is increasing, we must go further, faster. A critical constraint on the ability to rapidly increase testing capacity is the availability of the chemical reagents which are necessary in the testing. The Prime Minister and the Health Secretary are working with companies worldwide to ensure that we get the material we need to increase tests of all kinds. And as well as increasing the number of staff on the front line and the tests which protect them, we must also increase the capacity to provide oxygen to those worst affected by the disease. We have just over 8,000 ventilators deployed in NHS hospitals now. This number has increased since the epidemic began, thanks to the hard work of NHS professionals. But we need more. That's why we are buying more ventilators from abroad, including from EU nations. And it's also why we're developing new sources of supply at home. Before the epidemic struck, we had very little domestic manufacture of ventilators. But now, thanks to the dedication of existing medical supply companies and the ingenuity of our manufacturing base, we have existing models being produced in significantly greater numbers and new models coming on stream. Orders have been placed with consortia led by Ford, Airbus, the Formula One racing teams, including McLaren, GKN Aerospace, and Rolls-Royce and Dysons. And I can announce that this weekend, the first of thousands of new ventilator devices will roll off the production line and be delivered to the NHS next week. From there, they will be rapidly distributed to the front line. And as well as increasing the capacity for ventilation, which helps support those patients worst affected, we're also increasing the capacity to provide oxygen to affected patients at an earlier stage in the process of the disease, helping to avert, we hope, the deterioration of their condition. A team led by UCL, working with Mercedes-Benz, will produce 10,000 new CPAP devices to support affected patients, and a team from Oxford University are also developing related technology. And in our determination to prevent as many patients as possible seeing their condition worsen, we are conducting rapid clinical trials on those drugs, including antimalarials, which may be able to reduce the impact of COVID-19 on those affected. But even as we seek to explore every avenue to slow the spread of the disease, to reduce its impact, and to save lives, I'm conscious of the sacrifices that so many are making. Now, I want to ask Stephen to run through the latest data from our Cabinet Office, Corona.
I think the next week or two will be critical as we move through. As I said in those charts, there are signs, Sir Patrick Vallance said yesterday, that transmission in the community is reducing. That's exactly what we would expect if the public comply with the measures to reduce social contact. But there is a lag, as I described, before we see that in the number of hospital admissions and then in the number of deaths. So I think the next week or two are going to be critical, but this is a start of a battle. We can stop this virus, but we're at the start, and we mustn't let go of the measures and let go of everything that we're doing. We have to keep the foot on the pedal, as I said, no complacency. I want to encourage the public that they are playing their part, but I don't want to give the message that we need to do anything other than maintain our compliance with the instructions. Everybody needs to do that because that is the only way that we will get through this.
Thank you, Stephen. Jenny, I don't know if you want to address Robert's third question, a sensitive question.